Hi everyone, welcome back to another episode of DxTx. I'm your host Sahan Insafi, and this week we're going to be talking about what to do when you need a prescription refill. And before we jump into this week's topic, as always, I really appreciate your support, and always please remember to like, comment, and subscribe below. So I wanted to make this video to talk about some options that you have available before you have to resort to coming into a hospital or into an emergency department, waiting 5-6 hours, especially during COVID, sitting next to potential COVID patients in order to fill something like a prescription for your cholesterol medication. So first things first, not all medications have to be refilled immediately. Obviously, it's important for you to take your medications exactly how they've been prescribed and follow the instructions in terms of how to dose your medications as per your bottle. But in extenuating circumstances, for a lot of the medications, especially when we talk about things like your cholesterol medications, you will reach a peak concentration in your serum or in your bloodstream where if you miss one dose, it's not the end of the world. So you do have a little bit of time. Of course, when you talk about medications such as blood thinners, insulin, or diabetic medications, the longer that you wait between doses, the more problems they can cause down the line. So certainly there are medications that would require to be filled on a more urgent basis. However, most medications, you do have a few days of playing room if you can't get into your family doctor to get that prescription right away. For me, as a clinician, I think the first best step for you as a patient would be to actually contact your trusted pharmacist and to discuss with them what options you have available. A lot of the times you'd be surprised, but for medications that you've been on for a very long time, your primary care providers, your doctors, nurse practitioners, physician assistants would have put repeats on those prescriptions. So you may not realize that, but if there's a repeat, you may actually not even need to go in for a prescription. The pharmacy may be able to just refill that prescription for you without any significant delay. Furthermore, the pharmacist can help you navigate the system and may be able to get in touch with your primary care provider in order to refill that prescription. In certain jurisdictions, pharmacies themselves can actually have the ability to refill medications that you've been on for a long period of time. So depending on where you live and depending on the legislation in those settings, the pharmacist may actually be able to help you out in those particular instances as well. So your pharmacist is a very great resource. Make sure you utilize it. And I would say, again, the first step when you need a prescription refill and you're not sure where to go because you can't get into your primary care provider would be speaking with your pharmacist. If you've now spoken with your pharmacist and you still are not having any luck, you don't know where to go to fill the prescriptions, another option would be to go to a local urgent care clinic or a walk-in clinic, especially for medications that you've been on for prolonged periods of times, and medications in particular that are not controlled substances, which means things like morphine or opioid medications, benzodiazepines like lorazepam, Valium, diazepam. Those medications oftentimes need to be prescribed by a sole prescriber, which should be your primary care provider. Those ones are very difficult to get refills for when it's not your primary care provider. But other medications that are safe and have no real potential for abuse and are not controlled substances, a lot of the times these walk-in clinics, urgent care clinics, will have no problems filling a prescription for your blood pressure medication, your blood thinners, your cholesterol medications that you've been on for years on end. These are safe medications. If you're familiar with them and have used them, oftentimes there will be no major concerns with filling up that refill for you. Obviously, if you're in a situation where you've exhausted all of these options, and I would be surprised in areas where, again, in a few days, you should be able to find a walk-in clinic or an urgent care to do this for you. But of course, if you absolutely have no other options and you've missed your medications for a couple of days and you're concerned, we will be happy to see you in the emergency department. But make sure that you've tried these steps, because I am certain as a frontline clinician that these steps will help you find the answers that you need in a more timely and efficient manner. So that wraps it up. Very straightforward episode. Hopefully that was valuable to you. And as always, please remember to like, comment, and subscribe below. I look forward to hearing your thoughts, and I wish you all the best. Stay safe.